Hi to everyone. I am Dr. Rana Pratap Maurya, Department of Orthodontics, School of Dental Sciences, Babu Banarsi Das University, Lucknow. I will discuss today about the mechanism of bone formation. Bone is a specialized tissue and it originates from the mesoderm. So the process of bone growth is called as osteogenesis. Means osteo means bone, genesis means formation. So bone is a calcified tissue and it contains 32 to 36% of organic matters and remaining inorganic matters. Bone supports body and are invested by soft tissues, muscles, blood vessels, nerve, etc. So these soft tissue, they have a direct influence on the growth of bone. As we have learned that according to Melvin Moss, the soft tissue structures, they causes growth of bone. So bone formation takes place by two basic modes. One is endochondral ossification, means for this it requires the templates of hyaline cartilage and then it will convert it into the bone. And second is intramembranous ossification, means direct formation of intramembranous bone. First oven bone, then hard and laminar bone. So in endochondral bone formation occurs by converting cartilage into bone. Means it requires the templates of cartilage for the formation of bone. So this type of bone formation seen in bones associated with mobile joints and some parts of the cranial base, like basal part of occipital bones, petrous part of temporal bone, and ethmoid. So there are mainly four stages in endochondral bone formation. First, in diagram, you can see the first formation of cartilage template, then chondrocyte differentiation from the mesenchymal cells, then primary ossification, and then the secondary ossification of formation of lamellar bone. So first, for endochondral bone formation, there occur the mesenchymal cell condensation and occurs differentiation of these cells into the chondrocytes. The chondrocytes are the cells which form the cartilage. So these chondrocytes, they form a hyaline cartilage, which is enclosed by the perichondrium from the outer surface. So this perichondrium is rich in blood vessels and they contain the osteogenic cells. Means they form the osteoblast and osteoclast, osteocytes. Also form the fibroblasts. The cells of cartilage are the first small and irregularly arranged. The area where bone formation is to begin, the cells enlarge considerably and then they arrange in regular manner. Like in diagram, here we can see these are the mesenchymal cells. So these are the areas where the bone formation is to be expressed. So first there occurs the, in center you can see there is condensation of the mesenchymal cells. And these mesenchymal cells, then they differentiate into the chondrocytes, which is cartilage forming cells. And these chondrocytes, they form the hyaline cartilage. Here, this is hyaline cartilage. And these hyaline cartilage, they are surrounded by the perichondrium, which contains the osteogenic cells. So as the cartilage grow rapidly, the intercellular substance surrounding cartilage cells, they undergo Calcification by the activity of enzyme alkaline phosphatase. These alkaline phosphatase, these enzymes helps in the calcification of intercellular substance, means spaces between the cartilage cells, which is released from the cartilaginous cells. So due to the calcification of intercellular space, the cartilage cells, they are undernourished because the supply of blood vessels is cut off, which leads to cell death and thereby leaving the empty spaces, which is called a primary area. Here in diagram, this area shows the hyaline cartilage enclosed by this is a perichondrium. This perichondrium is rich in blood vessels and contain osteogenesis. This black area, these are the intercellular spaces, and these are cells are cartilage cells which are enlarged. And these cartilage cells, they secrete alkaline phosphatase and the calcification of the intercellular matrix takes place. And due to the calcification of intercellular spaces, these osteoblast cells, osteocyte cells, sorry, chondrocyte cells, they lack nourishments and it becomes dead and leaving to empty spaces which is called a primary area. The primary areoles formation takes place by dead of chondrocyte cells. These are the dead cartilage cells, and this black area shows the calcification of intercellular space. So after the calcification of intercellular matrix and formation of primary areole, from the perichondrium, the blood vessels invade the calcified cartilaginous matrix. So they are accompanied by the osteogenic cells. So these blood vessels, along with the osteogenic cells, they are called the periosteal buds. They eaten up the calcified matrix. Thus, primary areoles are fused, thereby leaving a large empty space, which is called as secondary areolar medullary space, around which the lamellar bone formation will take place. So this is the secondary areole. It occurs by the fusion of primary areole after eating of the intercellular matrix by the uh, periosteal buds of perichondral buds. These are the calcified bars. These invasion of blood vessels and osteogenic cells from the perichondrium, these colors are inverted. These are the secondary areoles and these are the intercellular space where the invasion of blood vessels takes place. So from the perichondrium, osteoblasts are formed from the osteogenic cells, and the osteoblasts, they secrete the osteoid on the remnants of the calcified cartilaginous matrix. So from the perichondrium, the two types of cells are formed. One is osteoblast, which secretes the osteoid matrix, and fibroblast, which secretes the collagen fibers. So around the, so these osteoid tissue, they laid by the osteoblast, they mineralize to form a lamellae of bone. And above this, layer by layer, osteoid secretion proceeds to form a bone. Thus, cartilage precursor is necessary in the endochondral bone formation. Here, this is the osteoblast. These osteoblasts, they secrete the osteoid matrix around the, this is a medullary space, a secondary area. So there is formation of osteoid layers. And these osteoid layers, they mineralize and form the first line. And the osteoblast cells, they move away. And the formation of layer by layer osteoid matrix, and these osteoid matrix, they are mineralized to form the lamella. So there takes place formation of successional lamella. So by layer, the bones formation will take place. These are sections of endochondral bones. There are 4 zones: zone of growth, zone of maturation, zone of erosion, and zone of endochondral ossification. These are hyaline cartilage template, columns of functional osteoblasts, chondroblasts, hypertrophied chondroblasts, cartilaginous matrix, calcified cartilaginous matrix, and degenerative chondroblasts. So we know that for every hard tissue and soft tissue formation, the 3 steps take place. One is hypertrophy, hyperplasia, and secretion of interstitial matrix. So for the hard tissue formations, along with these all 3 process, first interstitial growth takes place, then they are later calcified to form the hard tissue structures. Second is intramembranous bone formation. For intramembranous bone formation, no cartilage precursor is needed. There is directly laying down of the fibrous membrane, like bone of calvaria, fascial skeleton. In calvaria, we know that the base of the cranial skull is formed by the endochondral bone formation methods, and outer means calvaria by intramembranous, like frontal bone, petrous part of temporal bone, squamous part of occipital. They are formed by the intramembranous. So intramembranous bone formation, 4 steps takes place. First, ossification centers form within thickened region of mesenchymal. Here, these are the mesenchymal cells, collagen fibers. This is the ossification centers. Osteoid matrix secreted by the osteoblast cells. Then, after the formation of osteoid matrix, it goes calcification. This osteoid undergo calcification. These are the osteoblasts, and some osteoblasts, they are entrapped during the calcification called osteocytes. These are newly formed calcified bone matrix called oven bone. Third is oven bone and surrounding periosteum formed. This is mesenchymal condensation to form periosteum, blood vessels, trabecular oven bone, and then the lamellar bones replace the oven bone as compact and spongy. These are structures: outer periosteum, and these are osteoperinatal cells, compact bone, and spongy. So in this intramembranous bone formation, first oven bone is formed, then it will be later replaced by the compact and spongy. So initially, the mesenchymal condensation takes place. Among them, few cells lay down bundles of collagen fibers, and other cells enlarge and differentiate into the osteoblasts. So in mesenchymal cells, 2 types of cells form. One which form the collagen fiber from the fibroblast, and other which form the osteoblast cells. So the osteoblast cells, they secrete the osteoid around the collagen fibers. We know that the osteoid is a gelatinous matrix. So due to its nature of gelatinous matrix, it flows in and around the collagen fibers completely. In diagram, we can see there is a condensation of mesenchymal cells, and then the formation of osteoblast cells and synthesis of collagen fibers. So these osteoid cells, blast cells, osteoblast cells, they secrete the osteoid matrix, and these osteoid matrix, they flow around the collagen fibers. So these osteoid calcify the form bone lamellae, and among the osteoblasts, some cells they become entrapped in their own matrix, and it is called as osteocytes. And remaining osteoblast cells they move away from the lamellae, and a new layer of osteoid is secreted and calcified to form one more layer. So by this addition of layer to the surface of existing bone, it is called as appositional bone growth. These are the omen bone. Here, first it secreted the osteoid cells, then calcified. These are the osteocyte cells, which are entrapped during the mineralization. These are osteocyte cells, lamellar bone, and this is newly formed osteoid layer. So layer by layer, the osteoid secretion occurs, and they convert it to the lamellar bone, and these osteoblast cells move away from when the layer of lamellar bone is formed, and these osteocyte cells which are entrapped. So the ossification process in different bones of the cranium. The purely intramembranous bone is maxillary bone and nasal bone in face, and parietal and frontal bone in the cranial wall. In both endochondral and intramembranous in mandible and in cranial basis, occipital, temporal and sphenoid bones. And purely endochondral bone is ethmoid. Next is mechanism of bone growth. So various mechanisms of bone growth are remodeling, growth field, growth site, growth center, growth movement, which may be cortical drift and displacement. Remodeling. Remodeling means bone change in shape, size by two basic mechanisms. Bone deposition means there is addition of bone, and bone resorption means removal of bone. So this process of both bone deposition and bone resorption, they together is called as bone remodeling. So these are two processes. One is bone resorption process and bone formation. Bone resorption process, it takes place by the osteoclast. It is osteoclastic activity. And bone formation is called as osteoblastic activity. These are the osteoblasts. Bone deposition means addition of new bone to the bony surface by osteoblastic activity. It is represented by positive sign. And bone resorption, removal of bone by osteoclastic activity, represented by negative sign. And relocation means progressive sequential changes in position of the bone as a result of bone remodeling. So bone remodeling is the differential growth activity involving simultaneous deposition and resorption on all the inner and outer surface. So by this process, in bone occurs change in size of bone, change in shape of bone, change in proportions of bone, and also the change in relationship of the bone with adjacent structures. This diagram shows the surface remodeling of a bone in the direction opposite that in which the bone is being translated. This bone is being translated. You can see this cart is pulling in forward direction. It shows the translation of the bone. So bone remodeling here, it takes place in opposite direction. The cart moving in the forward direction and deposition takes place in the opposite direction, in backward direction. It is represented by positive sign, deposition and resorption by the negative sign. So surface remodeling of bone in the direction of opposite that in which the bone is being translated here by growth of adjacent distance and creates a simultaneous analog that depicted in this cartoon. The wall is being rebuilt to move it in backward direction. At the same time, this platform on which this structure is mounted, it moves in a forward direction. So forward direction, it indicates the translation of bone. And here it shows the deposition or remodeling. You can also see in this diagram, this is the mandible at early age. So as the mandible lengthens, the ramus is extensively remodeled. You can see from the ramus, there occurs resorption on the anterior border as well as deposition occurs on the posterior border of the ramus. So as the mandible lengthens, the ramus is extensively remodeled, so much so that the bone at the tip of the condylar process, first diagram, at an early age can be found at the interior surface of the ramus at the years later. In dark yellow diagram, we can see that in white, the distal end of the condyle, it becomes interior border of ramus at later stage. Growth field. Outside and inside surface of bone are blanketed by mosaic-like pattern of soft tissue, that is cartilage or osteogenic membrane. It is called as growth fields. These, when altered, are capable of producing an alteration in growth of that particular bone. We know that the bone does not grow itself. It is grown by the environment of soft tissue growth. Means soft tissue causes the growth of bone. Means growth in soft tissue. For that growth in soft tissue, for the compensation of that growth, the bone is grown. Means bone react to growth of the soft tissue. Like in brain, as a growth field causes growth of the ganglion. In encephalopathy, where there is a little growth or no growth of bone takes place, then there is a minimum or development of skull takes place. In hydrocephaly, there causes enlarged skulls. It shows that the soft tissue causes a growth of the hard tissue. This diagram shows the growth fields. Like here, this shows the attachment of lateral pterygoid muscles, middle pterygoid muscles, genoglossus muscles, uh, the from the outer surface attachments of the masseter muscle, temporalis muscles. So these causes the growth of the bones. Growth sites. Growth sites are the growth fields that have a spatial significance in growth of that particular bone. Like in mandibular condyle, maxillary tuberosity, syncondysis of basic cranium, sutures and alveolar bones, they are the growth sites. So growth sites, they may possess some intrinsic potential to grow. Like in diagram, we can see these are the synchondroses. This is a growth sites. Here these are the sutures, show the growth site. Alveolar bone, head of the condyle, maxillary tuberosity. They are the growth sites. They have a special features, uh, properties for the growth, where the growth, rapid growth activity takes place. And growth centers, these are the special growth sites which have inherent growth potential and they control the overall growth of the bone. And these growth centers, they are independent of the environment or independent of the local factors, because environmental factors that cannot control the growth of that particular. They have an inherent potential, an intrinsic potential for the. All growth centers, they are growth sites, but not all the growth sites are growth centers. These are the major difference. Means all growth centers, they are growth sites, but all growth sites are not growth centers. Like synchondrosis, nasal septal cartilage, epiphyseal plates of long bone. They are the growth centers. Growth movements. Growth movements are two types. One is displacement and cord growth. Displacement means it is a movement of whole bone as a unit. And it can be of two types. Primary displacement, also called as translation, and secondary displacement are translocations. Primary displacement are translation. So displacement of bone as a result of its own growth is called as primary translation, displacement or translation. It is active process. Here, displacement of bone occurs by its own growth, like maxilla grow with deposition of the bones at the tuberosity region. And the formation of new bone at its posterior end, it results in the pushing of the maxilla against the cranial base, which results in displacement of maxilla in downward and in forward direction. Like here in diagram, the deposition takes place at the posterior at tuberosity region of the maxilla, posterior superior surface. So by this, it pushes against the cranial base. So it moves in forward and in downward direction. Means the displacement occurs due to growth of maxilla itself. Here in this diagram, this structures moves in forward direction by deposition, by addition of breaks in forward direction. And in secondary displacement or translocation, it is passive process. Means displacement of bone resulting from the pull or push of the growth of the peripheral structure or adjacent bones. Means displacement of bones does not occur by its own growth. It occurs by push or pull of the growth of the adjacent bone structure, not by its own. Like growth of the cranial base pushes the entire maxilla in forward and in downward direction. So this displacement is passive in nature, whereas primary displacement is active in nature. Like here, the maxilla displaces in downward and in forward direction by bone growth at the cranial base. When growth occurs at the cranial base, it pushes the maxilla in downward and forward direction. Like here, this structure is moved in forward direction due to the pulling of cart in forward direction. This platform is moves in forward direction, not by growth of this structure as we have seen in the primary displacement. Second is cortical drift. Cortical drift is a type of growth movement occurring towards the depository surface by a combination of resorption and deposition. We have seen that, learned that resorption means removal of bone and deposition means addition of bone. Like here, this structure moves in forward direction by addition of breaks. Here, there is a destruction of this structure. X is initial structure and Y is final structure. Here the bone resorption takes place and here bone formation takes place, deposition takes place. So this cortical bone, it moves from X to Y position by combination of both bone resorption as well as bone deposition. A drift of bone may occur in same direction as displacement. Like here, palate, it moves in downward direction. And deposition also takes place in this area, in downward direction. So drift of bone may occur in the same direction as displacement. And also drift of bone may occur in opposite direction of displacement, like condylar growth and maxillary growth. Here the condylar growth takes place at the posterior superior surface, but the mandible moves in forward and in downward direction. Same, this maxillary growth takes place under posterior surface, posterior superior surface, at tuberosity region. But the bone या maxilla is displaced in downward and forward direction. If bone deposition and resorption on either side of a bone are equal, then the thickness of bone remains constant, like cranial. Here, the pace of bone resorption as well as deposition is same, equal. So this thickness is maintained from initial to final stage. But if more bone is deposited, like here, in one side, and less bone is deposited, a resorb, means more bone is deposited on one side and less bone is resorbed on the opposite side, then the thickness of bone will be increased. Here from initial to final stage, we can see that the thickness of bone is increased. If resorption dominates deposition, means more bone is removed from one side and less bone is deposited, then the thickness of bone is decreased. In dimension of bone is decreased. Here you can compare the initial and final thickness of bone. The final thickness is less because there is more resorption occurs. Thank you. I hope that you have learned about the methods of bone formation. Thank you.